Aesthetic treatments have traditionally been the realm for women, but male treatments are becoming ever more popular. Often my male patients present with the complaint that they're accused of looking unapproachable or even angry in the boardroom, and that has an impact on how other people perceive them. For those who have permanent frown lines or deep-set forehead lines, neuromodulators, and the colloquial term that we use for this is Botox, works wonderfully. Botox softens the appearance of lines and wrinkles that form with movement. So no longer do we have to look scowly when people approach us. Men, like women, also have volume loss, specifically in the mid-face area. This is the area there. And that leads to sagging of tissue, creating deep nasolabial lines. These are the lines that run from the corner of the nose down to the mouth, and loss of volume in the mandibular area. So this is the area just underneath the mouth. And often this leads to sagging in the corners of the mouth or the formation of marionette lines. Revolumizing of the midface can lead to a natural softening of the nasolabial lines, and when placed correctly under the chin or on the chin area, helps with turning the mouth back into a more natural looking smile and takes away that grumpy look. When asked, a male face is made more handsome when they have a strongly defined jaw, square chin, and sharp cheekbones, not rounded. And this we can do with the help of tissue fillers. A lot of the men that walk into my office say the last thing that they want is to look treated. And here we can use the biostimulators like Sculptra. What the biostimulators do is it stimulates natural collagen production without giving us any volumization. And this leads to a tightening and lifting of the skin, which is very natural looking, gradual in onset, and long lasting. Aesthetic treatments can give you a fresher look. It can make you look more presentable and approachable, and is something that all of us at some point can consider. I've been practicing as a medical aesthetic practitioner for 22 years, and I train lots of doctors on how to assess patients effectively. Understanding the cause of facial aging is crucial in working out a treatment protocol and treatment plan suitable to our patients' needs.